Hi, my name is Dr. Landon Pryor. I'm a board-certified plastic surgeon, and on this channel we're going to talk about luxury self-care practices in all forms. Welcome to today's open conversation about lip filler. Our nurse practitioner Susie will be talking about the pros and cons of lip filler and how you can get bigger lips permanently. Please be sure to subscribe below and leave any questions or comments about lip filler.
For years, I never had an upper lip. When I smiled, it would completely go away. I was always jealous or envious of girls that could wear, bold and bright lipstick and had fuller, luscious lips. And I always felt really self-conscious to wear lipstick, lip glosses, because I didn't really have an upper lip. So that's why I wanted to get lip filler. So I came to Susie, and we originally started with a Restylane Kiss. We did one syringe of that, loved the result. However, it just didn't give me the volume that I was hoping for. So after we did a syringe of Restylane Kiss, Susie made a wonderful recommendation to switch up the filler and go for, I think we did a Juvederm.
Maybe an Ultra or something.
Yeah.
There's just lots of choices, so.
I think that was nice too, having multiple options and being able to sit down with Susie, go through it, have her show the consistency of the fillers and what I was kind of looking for. After this time getting the Juvederm, I feel like I haven't had to maintenance it as much either. It's lasted a lot longer.
And some people do better with one product over the other, and we don't really know unless we try. And
yeah, absolutely.
There's always something appropriate for everybody. There's obviously a lot of things online that people are doing. I think if you look at TikTok or any of the IG reels, you'll see people doing facial yoga or using, there's a trend with the pop bottle that people are putting their lips in and creating some kind of suction. I would say that, that's obviously a short-term thing that can also be uncomfortable and dangerous, so I would not advise doing that. As far as facial yoga, I think that there's probably a place for that, but realistically, the changes that people want to see probably aren't going to happen from doing facial yoga at home. When you're replacing volume, there's really no great way to replace that other than adding volume, using fillers, or using your own fat or some kind of product like that. So I hear Jess's story a lot. The no upper lip thing is pretty common, especially when you smile. However, there's a couple ways to even address that alone that don't totally involve filler every time. But filler is a great way to add projection to the lip, and it lasts quite a while, depending on the patient again.
Since it's made of HA, your body naturally metabolizes that over time. So
yeah.
If you're working out a ton,
then you would expect to not have the longevity that someone that is very sedentary would have.
Exactly. So, well, now I feel like I'm really sedentary.
You should definitely sit around more often. So when you're getting ready for lip filler, you want to clear your schedule. at least for a couple days. So don't get your lip filler and have a wedding the next day. That's usually not, a good idea. Typically with lip fillers or any fillers in general, we'll see swelling and or bruising. So you always want to kind of prepare for that and then be pleasantly surprised when it doesn't happen, if it doesn't happen. Things to avoid before injections would be anything that thins the blood. So the biggest culprits typically are things like aspirin, ibuprofen, fish oil, and alcohol. There are some supplements that can also kind of thin the blood. If you're on any prescription blood thinners, you definitely want to let your provider know about that. But avoiding those things prior to injections with the okay from your doctor if they are prescription is beneficial, usually a week in advance. So yes, there are lots of products on the market. We carry quite a few here in our practice. They all kind of serve a purpose and they're all fantastic. So this is just a little sample from one of our vendors that creates a great product called Restylane, and there's a whole portfolio of products that are kind of great for every space in the face. When it comes to kind of picking the appropriate product for the areas that we're injecting, you really want to be able to trust your provider to make that decision for you. Each of these products is FDA approved for a certain place in the face. Each product kind of has a different viscosity or thickness to it. So thinner products are more appropriate in areas where the skin may be thinner or for patients that really want a natural look. Most of our products are indicated to last anywhere from a year to 2 years, depending on the product. And that's something that your provider can help you navigate and choose the best products for the outcomes that you're looking to get. So when a patient comes in, we have a conversation about the look that we're going for. So some people like a fuller upper lip, some people like a fuller lower lip, some people like them to look even. It's very personal, it's your preference. There's kind of the gold standard of the upper lip to lower lip ratios, but really it's very personal. So we talk about what we're going for. So when we look in the mirror, kind of point out any asymmetries, any inconsistencies, and kind of what we want to do with the lip. Then we talk about products because there are a variety of them and there's something for everyone. So if you want a very natural look to the lip to make them look hydrated, there's a product for that. If you want to go big, there's a product for that. So there's a little something for everyone. So we kind of, determine what product to work with. And then we get some photos for your chart, so we always have a baseline to compare the before and afters. That way, when you come in for your follow-up, we can say, you've lived with your lips for a month and you're like, oh, I don't know if I notice any difference. We like to look at the photos to show you that yes, there's definitely differences, but maybe we want to go bigger. So once we've done that, then we make you comfortable. So the lips are a sensitive area to inject, so we want to make you as comfortable as possible. So we'll apply a topical numbing cream around the mouth and let that sit for a little bit.
And honestly, really, if you let it sit for a little, the pain is very minimal. It doesn't, I think the anticipation of originally getting it done first was more overwhelming than actually having it done. So.
I think it's hard to set someone up for pain, but we'll make you as comfortable as we can. And some people even opt to not have topical. They're very brave.
Well, isn't there a numbing in the...
Yeah, so there is lidocaine in the product, so as we work, it does get to be a little bit more comfortable. And there's a few different injection techniques, and some of them are maybe more comfortable than others, depending on the patient. So we kind of just talk about those things and just make sure that you're comfortable with what we're doing and we're on the same page. And then, we get you cleaned off and then we do the injections. And it's very interactive. So I'm very much sharing the mirror so that we can talk about what we're doing, if we're happy with the direction that we're headed, if there's anything more that you want me to do. But once we're done, we talk about home care and then you head home. Something that comes up with lips often is the perception that if you're going to get lip filler or filler in general, you're going to look fake or plasticky. There's ways to naturally do a lip. We just typically use a thinner product or a different injection technique to give you a more natural outcome. For patients that are looking to really augment the lip and have nice full lips, we have thicker products that we use and different techniques to achieve that look as well.
Yeah, I think the first 2 times I got it, nobody even really said anything to me.
I think a lot of people come in and they're like, nobody knows I'm doing this. So they don't want to walk out the door and have this huge change. You kind of want it to slide just under the radar enough where people are like, oh my gosh,
You look great.
you look amazing.
Yeah.
Or that lipstick color on you is fantastic, and it's a shade that you never would have worn otherwise. And I think that if we go slow, you know, that kind of like lessens the risk of somebody calling you out. And it's important too that, you know, we don't inject you with 7 syringes at once. Kylie Jenner did not get those lips in one visit. Those, you know, we all know where she started and we know where she landed, and that was not in one visit. So it's a process, and we kind of build up things, and we leave time for the tissue to expand and accommodate filler in a safe way so that it doesn't want to migrate up around the mouth, because that's when you start to see people that have like a white hue around their lips, and we're not going for that look. Yes, there are definitely ways to, I think the biggest thing that comes up is I love to wear lipstick, but it bleeds into the lines of my lips. Or I don't like how my lips look cracked, or they're just not as hydrated as looking as I want them to. So there's even ways to just make the lips look more hydrated with filler instead of having to constantly use chapstick. Patients do ask for ways to kind of cut down on that lip liner bleed, or, you know, they tend to overline their lip to make them look bigger. So there's ways to kind of enhance the lips with fillers to, you know, cut down on, you know, having to be really creative with makeup to make your lips look fuller, or to stop, you know, that lipstick bleed into the lines. So there's things that we can do to address that with fillers. So I do get us that. There's a backup plan. So let's say you get lip filler and you don't like it for whatever reason, we can completely get rid of it. So, you know, it's nice to know there's a backup. So if you want to try it and then it's overwhelming for you, or you decide you don't like the look of it, we can very easily break it down. A very simple procedure, and, you know, you're kind of right back to where you started.
I think that kind of put me at ease too, is just like going to a med spa with obviously you having such, I mean, what, 12 plus years in this specific industry, like really also helped me and my nerves. Like, I only trust Susie with my lips now, and I won't go anywhere else.
Well, I think that we have to be careful about permanent big lips, because we still age, we lose volume. There's a lot of facial changes going on all the time that, you know, a permanent big lip might be really exciting now, but not something that you want later on. You know, there's different ways to fill the lips. So fat grafting done in surgery is a great way to add volume to the lips that probably has more longevity to it. But, you know, again, as we age, we lose volume, so you would eventually lose some of that too. We have lip implants that are little silicone implants can be placed in the upper and lower lips, and those are much like a breast implant where they have a lot more longevity to them. They can be removed at some point if you want, and you can have them replaced for larger sizes. So there are some ways to do more of a permanent bigger lip, and they are still kind of reversible. Botox is a great way to even enhance the lip without even putting filler in the lips. So there's quite a few options. It's just got to be the right choice for you, and that's sort of what we would want you to do, is set up a consult. We kind of navigate all of those things and help you make the right choice for yourself.
If you like this video, please give us a like below, ask any questions or comments you might have, and subscribe to be notified of future videos. We'll see you next week.